What organ of the lymphatic system is the site of T-cell maturation? A. The thymus. B. The spleen. C. The cisterna chyli. D. The lymph nodes. The answer is A. The thymus. T-cell maturation occurs in the thymus, a small organ located in the upper part of the mediastinum, between the heart and the sternum. Mature T cells then may either circulate in the lymph or blood or reside in lymph nodes. The spleen is not a site of T cell maturation, though it does have other important immune functions, such as the production of antibodies and the removal of antibody-coated pathogens. The cisterna chyli is a part of the lymphatic system that is involved in lipodigestion. Digestive fat is absorbed through what specialized lymphatic vessels of the small intestine? A. Villi. B. The cisterna chyli. C. Lacteals. D. Microvilli. The answer is C. Lacteals. Dietary fat is absorbed via lacteals, small lymph vessels contained within the body of the intestinal villi. Microvilli, tiny projections covering the surface of the villi, help with the absorption of minerals, vitamins, and other micronutrients. The cisterna chyli is a dilated pouch at the lower end of the thoracic duct that serves as a collection point for fatty chyle from the intestinal lacteals. Which of the following is not a function of the lymphatic system? A. Absorption and transportation of dietary fats. B. Lymphocyte transport and activation. C. Secondary gas exchange. D. Draining of interstitial fluid from tissues. The answer is C. Secondary gas exchange. The lymphatic system has several roles in the body, including drainage of interstitial fluid from tissues, transportation and activation of lymphocytes, and absorption and transportation of dietary fats. Red blood cells, however, are unable to enter lymph vessels, and so the lymphatic system does not participate in any type of gas exchange. When drawing blood, the client tells the nurse that she is a universal recipient. The nurse knows this to mean that the patient has which type of blood? A. O negative. B. AB negative. C. A positive. D. AB positive. The answer is D. AB positive. AB positive is a universal recipient, meaning a patient with AB positive type blood can receive a blood transfusion using any type of blood. Every Hem group in hemoglobin encloses an atom of what element? A. Magnesium. B. Chromium. C. Copper. D. Iron. The answer is D. Iron. Each Hem group in hemoglobin encloses a single iron atom in the center of a protoporphyrin, a tetrapyrrole composed of 4 pyrrolyl rings linked together by 4 methyl groups, 2 vinyl groups, a methane bridge, and 2 propanoic acid side chains. What is the average lifespan of an erythrocyte? A. 4 months. B. 6 weeks. C. 6 months. D. 3 months. The answer is A. 4 months. The average lifespan of a red blood cell is 4 months, after which it is phagocytosed by macrophages, the spleen, liver, or lymph nodes. White blood cells, on the other hand, live for only about 3-4 days. What hormone stimulates the casting of new red blood cells? A. Luteinizing hormone. B. Vasopressin. C. Erythropoietin. D. Thyroxine. The answer is C. Erythropoietin. The casting of new red blood cells is stimulated by the hormone erythropoietin, EPO, released from the kidneys. Recall that all blood cells are made in the bone marrow. This hormone may increase as much as 1,000-fold in times of oxidative stress. Thyroxine is T4, the most biologically active form of thyroid hormone. Vasopressin, or antidiuretic hormone, is part of the body's fluid balance system. Luteinizing hormone is a hormone of the reproductive tract. In females it triggers ovulation, while in males it stimulates Leydig cells to produce testosterone. Where is erythropoietin produced? A. Peritubular interstitial cells of the kidney. B. Lactotroph cells in the pituitary gland. C. Zona fasciculata cells of the adrenal glands. D. Supraoptic and paraventricular cells of the hypothalamus. The answer is A. Peritubular interstitial cells of the kidney. Erythropoietin is produced by the peritubular interstitial cells of the kidney. These cells are very sensitive to tissue oxygen pressure. When oxygen demand increases, erythropoietin is released, stimulating the casting, hematopoiesis, of new red blood cells in bone marrow. Supraoptic and paraventricular cells of the hypothalamus are the site of vasopressin, antidiuretic hormone, production. Lactotroph cells in the pituitary gland are responsible for the production of prolactin. Zona fasciculata cells of the adrenal glands produce cortisol. Neutrophils make up what percent of white blood cells in the blood? A. 20 to 35%. B. 55 to 70%. C. 70 to 90%. D. 2 to 6%. The answer is B. 55 to 70%. Neutrophils are the most common type of white blood cell, making up 55 to 70% of the total white blood cell population in the average blood sample. Eosinophils make up what percent of the average white blood cell count? A. 5 to 15%. B. 1 to 3%. C. Less than 1%. D. 20 to 40%. The answer is B. 1 to 3%. Eosinophils are the leukocytes that are largely responsible for response to parasitic infections and allergies. They make up 1 to 3% of the average white blood cell count. They form the second smallest population of white blood cells, after basophils, which normally make up less than 1% of white blood cells in whole blood.